Hey, it's Dr. Andy. This is episode 14. I want to talk to you now about who you trust. I think one of the important things about this is to think about where you're getting your information from. And specifically, this came up because I hear questions a lot of times of people saying, hey, I heard about this from Dr. So-and-so. Or they forward something to me that says a particular thing and it's from Dr. So-and-so. And so the reason I think this is so important is because we probably oftentimes think, hey, COVID-19, that's a medical issue, and so a physician, yeah, they're an expert on this, right? Yes and no. And I think it's important to understand why there's a yes and why there's a no. So medicine. So physicians are trained in medicine, and so they are experts in medicine. I'm a physician. I'm good with that. I trust docs to tell me how to treat myself when I'm sick. And that's what medicine is, treating an illness, okay? So the problem with that is that bigger than medicine is this thing called health. And medicine is really just a part of that, okay? So here's health. And so there are health experts that know answers about health, but that don't necessarily treat medicine, and then there are health questions that physicians don't necessarily know about that. And really, when we go even bigger, there's this thing that we call public health, okay? And so public health experts know a lot of answers about public health questions. And what we're dealing with here is, for many of the questions that I hear people talk about, it's really a public health question that they have. So a physician who is trained very well in medicine may not know the answer to the tools and experiences that come from public health, the tools used to manage disease for a population level. They know how to treat an individual. They know how to treat one person really, really well. It's very specialized. Even when we get to medicine, that breaks up into small specialties, right? So they become very specialized in treating an individual. Why am I okay to be talking about this? Well, I'm a physician, right? I'm a public health specialist, or I'm an occupational medicine specialist, which is one of the specialties that is considered to be a public health expertise. Preventive medicine is what we call it. And so an MPH, that's one of the degrees I have, a Master of Public Health. That came with that specialized training. So my focus in medicine was to learn about the big piece. So when you hear about something that one particular doctor says or thinks, or what they did with their patients in their clinic, that's good. But their expertise is about taking care of individuals. There are plenty of physicians that know a lot about public health too. A lot of them have an MPH or something like that. Some of them don't, but they work so long in public health that they gain the expertise. So there are physicians that do know this, but if you see that MPH or a DRPH behind that MD or DO, then you know that they specifically have public health knowledge. Or if you see that they've been working in the public health field for a long time, at a county or a state or the federal level, or sometimes globally, then you can know that, okay, they have an understanding of the public health questions related to this issue, not just treating an individual. So that's that's what I got for you today. Again, I'm Dr. Andy, trying to make the world a better place by teaching you public health.